Good morning, ladies and gentlemen, and welcome to this webinar on coronavirus, on a series of webinars that we at the Nkafu Policy Institute have been undertaking over the past couple of months, actually over the past now 7 to 8 months since the start of COVID-19 back in January, late December, January, but really since March 2020. Um, this webinar is an opportunity for us to get to know what is new in regard to coronavirus management, especially in the African context, the lessons we are learning in the current state of affairs, the issues regarding vaccines and vaccine development and the candidate vaccines that have actually being tested currently and where things stand. We are putting this in the context of our African health system and figuring out ways in which we are able to improve and prepare better for other pandemics that are sure to come. I am joined today by Dr. Bernard KADIO. Dr. Bernard KADIO is in North Carolina. Dr. Bernard KADIO is a professor at Bob Jones University and also the director of the Center for Community and Global Health there. Dr. KADIO is originally from Cote d'Ivoire. He completed his MD degree at Université Houphouët-Boigny University in Ivory Coast. He then went on to Senghor University, where he did a master's in public health, and went to the University of Ottawa, where he completed his PhD, a PhD in public health. I think he worked with Dr. Sani Yaya at the University of Ottawa. Dr. KADIO, it's really an honor for us to have you here. Welcome.
Thank you very much. It's my pleasure to be with you this morning. This evening in West Africa. Here it's just 9 o'clock in the morning.
Yes, no, thank you very much for that. Now, this conversation, I want us to have a very broad conversation today. Now, if we were to start just looking at the COVID-19 management in Africa, what would you say, just as an opening, to the current state of affairs in Africa as we know it?
Well, thank you very much, and hi everyone. I could say for one time, the public health and population health community is surprised because Africa actually, the sub-Saharan African countries have reacted very well as compared to what we were expecting. Back in March, when we heard the first news about the pandemic, the major concern was for African countries. I mean, we remember that the World Health Organization issued a warning for international help to African countries because it was all the projections were saying that Africa will be hit very hard and very badly. But now that we are dealing with a matured pandemic, we can see that African countries have reacted very well, and there are a lot of explanations for that, and we will definitely get into this later during this conversation.
Yeah, so as of today, as of this morning, looking at the number of cases, the total number of cases reported in Africa, I mean, we are at just over 2.7 million cases or so. Oh no, actually 2.27 million cases reported so far, and just over 55 or close to 55,000 deaths. Now, regarding this current state where we find ourselves, and somebody like Anthony Fauci has called this, we are at a point where there is a surge within a surge. How do you, what is your global view as to how everything looks from as of today?
Well, it's very difficult to predict at this point. It looks like we are seeing some I would say if we based our analysis on some European numbers, it looks like we are seeing the end of the tunnel at this point. It's the beginning though, but things are improving slightly. Although we have places like the US where we are seeing like a major surge, but the US is completely, the US dynamic, social dynamic, political dynamic, health dynamic, it's completely a case study in itself. So we cannot make a general conclusion based on what's going on in the US. It's just like doing some, when we do public health in Africa, you always have to kind of keep an eye on what's going on in Nigeria and then have the other countries. So it's difficult to have a global view. However, it looks like we are starting seeing probably the end of the pandemic. And what was going on actually, um, based on the strains of the virus, actually there were like 2 or 3 pandemics going on, actually. It was not just one pandemic. There were 2 or 3 pandemics going on and overlapping sometimes in Europe, for example, or even in Africa. But it looks like we are heading toward the end of the pandemic at this point.
So it seems, a couple of months ago, I had Professor Dr. Nkengasong here when we talked about how the Africa CDC had, planned and responded to, to the pandemic and continues to actually lead the way in that response. One of the things he remarked, which is that as the pandemic started in China, folks were expecting it to come from China, at least in the African context, but instead it came from Europe. It came from Europe, and the historical links between Europe and Africa in general,
Yeah.
so to speak. What can you speak into regarding that link and the strains that we find in Africa?
Yeah, a very good question. So, yes, actually, this is what we call an inoculation of Africa. And sub-Saharan Africa was inoculated by European travelers. Actually, it's now very well documented that the virus came from Europe to Africa into countries like Senegal. And then we know now that there was a mutation that happened in Africa. And then that mutation went back to North Africa. And then from North Africa went back to Europe. And that this triggered another pandemic currently August. This was the strain that triggered the pandemic during the months of July and August in Europe. So something happened in Africa. Yes, if the virus came initially from Europe for most of the African countries, although there is some discussion about countries like Ethiopia being inoculated directly from China. But most of African countries had the virus from Europe. And what happened there is still a subject of research because when the virus came to Africa, then a mutation happened. A mutation happened probably due to local ecological social dynamics. A mutation happened, and what was expected to be a massive explosion in number of cases never happened. But when the virus went back to Europe, it triggered a second wave there in Europe, especially in the Marseille and southern part of France area.
So that's a very interesting, point you raise, because as we think of the number of cases, and also is particularly the fatality, of the fatality, the case fatality in sub-Saharan Africa has been much lower.
Yeah.
You know, some of the this has been ascribed, or some people have made the argument that the population is extremely young, and so that place which with less comorbidity, so though non-communicable disease percentage continues to rise in sub-Saharan Africa. How do you read the case fatality in many sub-Saharan African countries?
Oh, uh, like I said earlier, yeah, that's a very, very, very good question, and we are still investigating and trying to understand what's going on in Africa. I mean, you can make a multi-level analysis, like starting with ecological argument. We know for sure that there is a connection between vitamin D at the molecular level. There is a connection between vitamin D and the vitamin D, vitamin C, and the virus. We know that there is a connection. Individuals that are deficient in vitamin D are more susceptible to the disease and even more susceptible to have kind of a more complicated form of a disease. So when you look at what we call the malaria belt in Africa, okay, not in Africa, around the globe, actually, in the malaria belt, spanning from Africa, West Africa, Sub-Saharan Africa, part of Latin America, and part of Southeast Asia. When you consider the malaria belt, then this is the area of the world where the people have the highest level of vitamin D because of exposure to sunlight. So that's one ecological factor that can explain, can be a first explanation. Then you have sociological, even you have biological factors as well. We know that there is some kind of cross immunity between some other viruses, other endemic coronaviruses. We know that there is cross immunity with the epidemic coronavirus. And we know that those endemic coronaviruses are circulating in the malaria belt. Even malaria itself, we know that we have some receptors of the virus that are implied in malaria as well. And this is why it was suspected that some malaria medicine might be effective against even the virus. So it's a multiplicity of factors. Then yes, you have sociological factors like a younger population. And working outdoor, even here in the US, we are seeing that 65% of the transmission is happening in individuals inside the homes. Even during the lockdowns in New York, 65% of the transmission happened to where people who stayed at home. So we know that socially in Africa, we have a very active population with a physically active population. So, I mean, you have the multiplicity of factors there that worked for us to this time.
Also, that's very interesting. Everything you're saying, there's a lot to dissect out there. Now, we are now 9 months or so since the great lockdown, as Georgieva, the IMF, managing director said the time of the great lockdown, and then build back better. The great lockdown that we see when these measures across the globe led by the West were undertaken to shut down, to restrict movements, as you said, indoors just 6 months ago, and everything. There have been lots of arguments that lockdowns like that were not effective, have not been effective, and it's been very difficult to, obviously it's still too early to have a good assessment of the effectiveness of that strategy. Now, what is your take regarding the great lockdowns? And I know these were differentially implemented in various African countries. you know what is your take regarding how well that work did not work in the global scheme of things?
Well, we have studies now that are coming out. One study was conducted in France, and I know very well the team that conducted the study, and we know now that lockdowns were not effective. That is almost a certainty now, and 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 this is kind of the lockdowns were used to kind of avoid two things, actually. They were used to avoid the kind of bottleneck effect in the hospitals and the panic mode. When you have a pandemic, what you want to avoid at all price, it's the panic, because the panic will completely change the dynamic of any kind of epidemic, severe or not. So this is, we can understand some, from a political standpoint, the reasons for lockdowns. However, from a strictly epidemiological standpoint, um, we know now that it was not effective a measure. And we know, we have studies coming out from Canada that there is a big increase in mental health now issues that we are seeing in countries like Canada, in terms of depression, in terms of suicides. So they were not very, very, very effective from a public health standpoint. And African countries, like you said, we applied measures coming from the West, but one first lesson that we have to take from this, and it's a big one, is that it's time for Africa to start trusting African researchers. 50 years ago, we couldn't do that because we didn't have a task force, but now we do. We have on the continent people that can sit down, can think, and can elaborate a strategy, even for a completely new disease. And that's the first take-home message. Because some African researchers said, well, probably we need to do our own things. And they did it in Senegal, and it worked very well.
Well, I think that that's a great segue into what you're talking about regarding the lead. I mean, just in the last month in the Financial Times, an elaborate, paper on what the world could learn from Africa's response to this pandemic.
Absolutely.
Talking about the quickness in which they trained staff across led by the Africa CDC and WHO Africa. They trained staff, Centre Pasteur in Senegal that you're referring to, the leadership from the director there and the entire staff across the continent, in Nigeria, in Ethiopia, and across the board. Now, that was one of the lessons that you are referring to, that you referred to. What are some of the other lessons, especially because some countries we were already Africa in general there's a lot of fragility, fragility, and many made the argument that locking down in a system where food insecurity was high, there was a lot of fragility. The side effects of the lockdown were probably more than the lockdown effectiveness,
Absolutely.
which you said. What do you talk about the other side of this?
Yes, definitely. It's funny enough, the lockdowns did more harm to us in Africa than the disease, the pandemic itself, unfortunately. And 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 uh, uh, and what we can say moving forward is that uh, what I'm very, very, very optimistic about the future of Africa, because Africa has a very resilient population. And to me, that would be one key of the future. In the coming 5 to 10 years, even when you conduct all the prospective analysis, you can see that countries in East Africa, countries in the southern part of the continent, you will see some kind of countries from Africa playing an essential role on the international scale. And the reason for that comes from the resilience of the African people. Although the lockdowns were kind of a strong economic burden to African countries and to African populations and to the most vulnerables, but there is that social dynamic where the people can kind of adapt rebuild and rebound whenever there is a hardship. And to me, this is something that will be very interesting to consider in the coming 2 to 3 years to see how, once again, the African population will adjust, will build resilience toward that, just like we did for the HIV pandemics. The HIV pandemic dropped the life expectancy to like 50 years. I mean, we lost 10 years of life expectancy, but now we are going back up. And this is Africa. We
Well,
always go back up.
yes. So I think that the resilience that you're talking about, I think we see that a lot now. Let me get your thoughts on the Ebola virus and the lessons learned from the Ebola virus in West Africa. Most that it was really hard hit in West Africa. One of the lessons we know is the offshoot from the Ebola virus experience was the offshoot of the Africa CDC, which really came after as a major response, one of the major uh, um, immediate short-term and long-term responses to pandemics and to health emergencies across the continent. Um, from your view and talking about this resilience that you referred to, how has what have we really learned from Ebola? And I know there are still some cases lingering around, maybe in DRC or so. How have we learned in that response, coupled with the malaria response and the HIV response, to help us, today?
Yeah, uh, yes. The Ebola, the 2014 Ebola pandemic epidemic in West Africa with Guinea, Sierra Leone, and Liberia, and the episodic outbreaks that we have in Central Africa, RDC and DRC, and sometimes Uganda. The what it was helpful in that, number one, we had in Africa, on the African continent, like you said, we have infrastructures to kind of react to a pandemic. That's number one. But the biggest effect of the Ebola pandemic, the 2014 Ebola pandemic, was that it increased awareness in the African population. And that's a key there. I mean, even here, when we were putting together our response plan on campus for our university, I mean, the level of information of people about infectious diseases were so low that we needed to go back and do the BAB of what is an infectious disease, how is it transmitted. But the African population, because of the Ebola outbreak, had already a heightened awareness in infectious diseases. And what helped us, even to some extent, was when the people said in the beginning that it was a virus that came from the pangolin, and then they were able to connect. They said, okay, no more meat bush, no more, they were able, this kind of, say, oh, it's like Ebola then. So some of the reflexes that the people developed during the Ebola outbreak came back, and that increased popular awareness was very, very, very essential in people understanding measures like hand washing, like social distancing. The land was already paved by the Ebola. To me, this is probably one of the greatest, not the greatest, but it was one of the advantage that the African population did have compared to the other populations.
Yes, no, I totally agree. That level of awareness was already there across, in many parts of the continent,
Mhm.
and you just needed, to direct the message a little better. Now,
Absolutely.
one of the players, let's focus a little bit, and I'll have everyone who is all of the attendees. If you have a question, you can use the chat function, or we would call you up to ask your question to Dr. KADIO. So you can put that up. one of the major uh, um, institution that has responded to that has led the response has been the Africa CDC and WHO Africa. But you've seen a lot from the Africa CDC, especially given the fact that it's a communicable disease that's there. Um, how would you, and I know it's still way too preliminary to rate, but how would you rate the effectiveness of the Africa CDC, how it's conducted itself and led in this during this period, and after that, where are some of the areas where we could improve?
Oh yeah, the African CDC did a great job. I remember very early in the pandemic, I was part of a webinar where they kind of called uh, some of the experts to kind of get a sense of what's going on and how can we build a response at the continent level. So I mean, that they did a very good job. Probably, to me, probably one of the areas that we will need to improve, and there are very few, and will be probably uh, again to we need we need to be at the point where we have an expertise in Africa today. We have an expertise. To, what I'm expecting from the CDC is for us now to start brand ourselves. Africa has a word to say, especially when it comes to infectious diseases. The West has lost the management of infectious diseases. They have lost it. And today, that expertise is in Africa. We have to say it, we have to say it loud, and we have to be able to say, okay, hey guys, if we are dealing with infectious disease, come to Africa, we can train you. To me, this is, yeah, we are at the point where we can do that. With nothing, we are able to say, okay, we have a coronavirus infection. Okay, this is what we can do. We don't need a very how many respirators do we have in Africa? How many respirators do we have? You see, yet we were able to manage complicated situations and people getting out of the hospital 10 days later, and they're doing perfectly fine because we know how to manage infectious diseases. And that, to me, the CDC should be instrumental in kind of branding Africa, saying, okay, if you are dealing with infectious diseases, come to Africa. We know how to take care of that.
Yeah, so one of the criticisms that has been raised currently is that at least for the Africa CDC, it's the current management or organizational reporting structure and mandate, even though it's supposed to be an independent continental wide organization, is still within the African Union, reporting to the chair of the Africa Union, rather than being a body that is outside that. So it's almost as though there is rather than the director of the Africa CDC leading, everything has to be approved by the AU chair also. So, and that's one critique of
Yeah.
the current response, which limits a lot of the agility, so to speak, even though they've been very agile in their response, but some of it's a bottleneck basically, even though it's not previewed there.
Mhm.
So that's one of the things that has been raised. Now, regarding the overall setup of the Africa CDC, any thoughts regarding that?
Well, no, I'm thinking that, yes, one of the ways moving forward will be more integration. We definitely need more integration. We are still a little bit too fragmented on the continent. And you touch a very interesting point, and it's not just even in the health sector. It almost, even with all the regional organization, we are seeing the same problem where there is not that direct connection between the regional organization and the population. And there is still that political channels that they have to go through, and it makes things complicated. But I think one thing that we can call will be more integration. In Africa, we need to be able to have more integration, more people from West Africa speaking to more people from East Africa, from North Africa. To me, this is probably one of the major challenges that we will have to face in the coming years.
Well, I mean, we're talking about integration, and as we know, January 1st, the Africa Continental Free Trade Agreement goes into effect. And I think Nigeria, Cameroon, they just ratified that, and we have the numbers, for everything to go into effect with the headquarters with the secretariat in Accra. Um, we it was very evident at the start of the pandemic. The various supply chains were really being bogged down. There was all
Yeah.
these bottlenecks, this scramble for PPEs,
Yes.
for the supply chains. China,
Yes.
doing face mask, diplomacy, gloves diplomacy, you know
Exactly.
and all of that, and then that notion of, yes, connectivity, but value chains, and value chains, not only in the health sector but
Exactly.
in various sector, and the need for that.
Exactly. 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 And here again, we have to trust the African population. I was in a meeting with some colleagues from Burkina Faso, and as soon as they understood the mask dynamic, Burkina Faso stepped up and they started producing face masks. And the same happened in Benin. And here we have such, I mean, I'm so proud to be an African, because the people from Africa, tell them what to do, they will do it, and with nothing, they will find a way to do it. They will. I mean, you see people in Burkina Faso starting making face masks at an industrial level. At an industrial level. I mean, that was fantastic. They said, okay, we do not have ways to have face masks. Okay, let's step out, let's do something. And they started working on it. And all of a sudden, you saw in all the streets of Africa, people selling face masks. We had face masks here in the US coming from Africa. And that they were,
Yeah, you know,
I still have
yes.
mine here.
that, that is a very interesting thing, and for us at the Nkafu Policy Institute, we are very we are really pro a free society, because and that example that you use is one of the key examples out there. Currently, I mean, it's the same thing that happened in Cameroon, where all the hand sanitizers and everything all of a sudden were produced ingeniously by Cameroonians and Africans across the board. And you
Exactly.
realize that if the systems were freer and open, and the African man and woman on the street could actually be not these monopolies were not there, the
Yeah.
level of ingenuity would almost be unmatched. I mean, it would be at
Absolutely.
least similar to what you have in Silicon,
Absolutely. Yeah.
Silicon Valley and all these other places, because you know that example of how people responded. And you see across the board now, even in ventilators, you have young Africans who are producing different ventilator ease to use ventilators within our system. So it's a very important point that you raise.
Mhm.
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 Yeah, so now let's touch base a little bit before we start taking questions on some issues regarding current state of affairs with vaccine. Now, for the general audience, what is your overall take regarding where we are with vaccine development and for the virus?
Well, that it was very good news when we heard some months ago that some breakthrough were being made in terms of vaccine, and that is kind of a milestone in the fight against pandemic, because this has never happened before. A new virus are coming, and less than 6, 7 months later, has being able to kind of have a vaccine. That's a big, great achievement. This being said, we have also to be cautious, because I've been part of a team who work on the vaccine against the Ebola, and it took us 5 years to develop a vaccine. So we have to be cautious. We trust the regulation agencies that are kind of issuing a certification about the vaccines. uh, it's good news, but we have to be very cautious. And once again, as in Africa, we have to get to a point where we determine if this is something we want, or if this is something we need even in Africa. So that will be a decision that our continental infrastructure will have to make. The CDC, for example, will have to make those kind of, the African CDC will have to make those kind of decisions. Government will have to make those kind of decisions.
Yeah, so one of the platforms that the Africa CDC has created is or at least, and led by President Cyril Ramaphosa as the current AU president, was the fair vaccine distribution, strategy. And currently, and I think in Africa there are many clinical trials of the vaccines going on. As of last month, I think there were close to 48 candidate vaccines being in human, testing, human testing phase or so.
Mhm.
And way more than 140 different vaccines in various stages of development across the world.
Mhm.
Now, regarding clinical trials in general in sub-Saharan Africa, what where do we stand, and what is the story from COVID-19?
Well, I remember it, back in April, there was that statement that was made from some researchers in Paris that triggered some kind of reaction. Uh, last semester, I taught a class on research ethics, and what we are saying actually, and even the WHO is kind of pushing for that, and Public Health Canada is pushing for that. What we are saying, number one, is we need in Africa, we need our African countries to put in place a regulatory framework to kind of have an ethical approach to clinical trials on the continent. We cannot, clinical trials are part of the development process. So we cannot say that we don't want to be involved in any kind of clinical trial. This will not be a viable route for us to go. However, we need to have strong legislation in place to have to see when it happens, is it ethical? Are we abiding by the general ethical guidelines that we have to abide by so that we can have a fair clinical trial? That's one point. Another point will be um, to be very strategic about it. Saying, for example, if a drug is not allowed in your country, you cannot sell it in Africa, period. The same drug, same name, same component, same everything. At least we can use this precaution while the countries are building an infrastructure for more regulations. We can say, okay, if you cannot sell a product in Canada, you cannot sell it in Uganda. If you cannot sell it in France, you cannot sell it in the Ivory Coast. And it has to be exactly the same product. No double production chain. It has to be one production chain, the same chain that produces Doliprane for Paris, for people in Paris, has to be the same chain that is going to produce the same drug for the people in Africa. This is the condition under which you can sell it in Africa. that can be kind of a precaution that we can use while we are building our own regulatory infrastructure.
Yes, thank you for that. Now, I see a question from Dr. Charlotte Mbowe. It says, thank you, Dr. Bernard, for your in-depth response to the COVID situation, especially here in Africa. According to recent reports, there are indications of already a second wave of COVID-19 infections in some parts of Europe and even in the US. Should Africa be worried about this, given the rate of infection has been quite stable here in Africa? I think you touched briefly on this before, but.
Mhm. Yeah, yes, there is this, we, we don't quite like the word of second wave, and especially for COVID-19, because it's basically a second pandemic. We have had like 4 pandemics in the pandemic. So, but should we be concerned, overly concerned in Africa? I don't think so. Given the current state of the affairs, I don't think so. I don't think that we should be overly concerned in Africa. Now, this is the COVID-19 world. We have to be cautious about what we say, but I don't think that Africa should be overly worried about it. And even in Europe, the second wave is kind of, we are seeing kind of the end of the tunnel. It's beginning to go down, even in Europe. The surge in the US, like I said, the US is a complete, we can take 5 minutes later to kind of discuss. The US is
Well,
very.
you can tell us about that. You can tell us about the peculiarity of the US case.
Well, the US, when we teach our students about the US healthcare system, we use 2 words. We say the US healthcare system is unique and it's complex. So the US dynamic here, what is happening here in the US it's completely different from, it's very difficult to make a generalization, because you have, for example, people here that have a mindset, they have a relationship to freedom that is such that you cannot even make a general recommendation. There is no Ministry of Health in this country. There isn't. And the CDC, the Center for Disease Control, can only issue guidelines that you are free to take or reject. And nobody can oppose anything to you if you reject it. So this makes it kind of a case study, because then you have different dynamics going on here. So seen from outside, it's like one country, but here, when you are inside here, we are dealing with like basically 50 countries.
Yes, I completely agree. There is this marriage to freedom, to freedom and independence. Independence, toward independence, to do what you please, in as much as it's not hurting somebody else.
Exactly.
It is your choice as an adult to make that
Exactly.
decision, and not for
Exactly.
anybody else to do. And you
Exactly.
cannot be mandated to do it, whether it's a vaccine, but except you are in a situation where it affects the health of somebody else.
Exactly.
So it's as you said, very unique, very peculiar thing, and you could not have the broad generalizations that you see in France and all these other
Exactly.
countries, where
Exactly.
they can
Absolutely. Yeah.
enforce that.
Exactly. Exactly.
So that's good to know. Let's see. As we start wrapping down, now we have a question from Sandy Mopia. Please, I have 2 questions. What explains the fact that COVID-19 patient treatment centers are empty in Cameroon while the government continues to count victims by the thousand? That's one. I don't know if there is that in other parts of of sub-Saharan Africa. The second is, what are the geopolitical stakes of COVID-19 for the pharmaceutical world in Africa?
Yeah, very, very good questions. Well, we have to, and I was on this, was it, I think it was 3 days ago, exactly the same question came out. and what we have to understand is that what is happening with COVID-19 from a pharmaceutical and the political view is, it's not new. It's not new. It's just that today we have an increased awareness of populations, whereby I can have an idea this morning, and before the end of the day, I can share my idea with people on the other side of the globe. So this is why we are seeing some things. But when there is an outbreak, when there is a war, when there is a pandemic, when there is an epidemic, some people are seeing money, some people are seeing power, while everybody is fighting for his life. So this has always been the case. We are seeing it with the COVID-19. It's not new. Even for malaria, there are some political interests that are involved in malaria. There are some financial interests that are involved in malaria. It's true for all the diseases, actually. So the bigger question, the deeper question is, how do we build a system where we have transparency? And that's a key, where we have transparency when there is regarding health issues in general. It's not just COVID-19. It's all across the board. For malaria, for Ebola, for high blood pressure, how do we build a transparent system for information about drugs, about the disease, and about management options? To me, this is the big question to which we should probably try to answer as institutes or as thinkers. I mean, we don't have an answer to that yet.
I have one more question from, there is a question from Henry Kwam. It says, actually, there are two questions I see. How can Africa integrate better? Are we talking about institutions or public-private partnerships? That's one. Secondly, how should we harness innovation across countries? Should these be event-based pandemics or based on Africa's shared healthcare needs? I think you just basically touched some of that also.
Yes, definitely. I wrote a paper some years ago about more integration in the health systems in Africa. That's, to me, that's big. We have to get, I think it was on November 26th, I was on the meeting with the West African Health Organization, WAHO. And they are the medical side of the ECOWAS, the West African Economic Cooperation for West African countries. And that they have a medical branch, which is the WAHO, but there is the SADC in East Africa, and they also have an integrated health organization. But to me, that's one key. It's really one essential key for the coming 5 to 10 years in African health systems, to build a kind of integration and a platform where we can be able to kind of share technology, share even patients. We are seeing it for countries like Singapore, Indonesia. We have to see something like this in Africa. The reason why I'm saying this is, if one country cannot afford to have like a high technology cardiology institute, for example, but a group of countries should be able to afford that. You see, so we can have, for example, in the Ivory Coast, in Cote d'Ivoire, a cardiology institute that is going to serve the whole countries in the region. And we can have in Ghana a brain institute that is going to serve the whole country in the region. And then we don't need to kind of have patients flying over to the West to have treatment, because it's just take the flight and go across the border, and that's a done deal. So integration of health systems in Africa, this is one essential key. Uh, we are seeing it in the economic area. We need to see it in the health and medical area. That's a key. Yeah, this is a key.
Yeah, you made a very interesting, point earlier, which I completely support the notion of, more transparency, and I believe that, just like you said, more transparency in governing across the board is one of our big, it's I would say maybe our Achilles heel
Yes.
in sub-Saharan Africa regarding our job creation strategies, our economic growth, our response to pandemics, our health system, our health infrastructure. That issue of transparency, openness, and how
Yeah.
you can hold authorities accountable
Yeah.
seems to be like the crux of the governance challenge that we have.
Yes.
And I could not agree more with you on that.
Yeah.
Now, just one thing before I take the last question, and as we start looking at it, you have, you have talked a lot about, the resilience in African, among Africans. Now, what is it if there were one, two, or three things as policy prescriptions, or as things that we needed to do? Because, for example, the Africa CDC came out of Ebola, the need for a continental-wide organization like the Africa CDC, for that. There will be many more pandemics. That there will be many more. I mean, if you had told me back in February, I mean, I was in the last time I actually was out of the country flying was sometime in the first week of March. I was in
Mhm.
Nigeria, and if you had told me that the entire world will come to a halt for 1 hour, I would have said you're crazy,
Yep.
right? That there will be the entire world will come to a complete shutdown for 1 hour or one day. I would have said it's total madness. But
Mhm.
these pandemics, we are going to have more pandemics. So how is it, or what should we do? What is that one, two, or three things that we have to do to be better prepared, more agile in responding, our just more resilient. We are already resilient, as you said, but more resilient. Not just that we are difficult to kill, or it's difficult for us to die, no, but that we are actually responding appropriately.
Very, very good question. Very good question. Uh, we, if we start the 21st century, the 21st century is being labeled as the century of pandemics. Uh, we knew we knew that every 50 to 70 years there was a big major pandemic that hit mankind. We knew that for sure. And some health agencies have been preparing for that even. But what is starting on the 21st century? We first started with SARS-CoV-1 in 2003, SARS-CoV-1. Okay, then 2012, we went on with MERS, the Middle East Respiratory Syndrome. And then 8 years later, to 2020, we have SARS-CoV-2. So just for the 21st century, and if I include the Ebola, the 2014 Ebola, it makes even four. So just for the 21st century, we are seeing more and more of the pandemic times. And why that? Number one, we have built a global village where I can wake up this morning here in North Carolina and eat supper in West Africa. I can fly and eat supper there. So that's one. But a second one is so first is globalization, but secondly, we are getting more and more closer to nature and to cultures that have some practices that kind of predispose to virus germs passing from one species to the other. The species barrier is no more working because of that proximity between mankind and nature. And in this case, probably this is what happened, is spillover. And even for SARS-CoV-1, for Ebola, for SARS-CoV-2, for MERS, it's always a spillover, one germ crossing the species barrier. What can we do from a policy side? Because if the 21st century is going to be a century of pandemic, we have to be prepared. One weakness of us African was that we don't prepare to see things coming. So everything that comes and hit us. So we have to kind of start preparing, because whether we like it or not, the 21st century will be a century of pandemics. We'll see more. The coronavirus is another one, but we have much more to come. Number one, we need to build an African level surveillance system. We have to be able, if I'm at the airport in Douala and I detect a case, that same day, the airport in Abidjan, the airport in Dakar, all the airport systems have to know that I have identified a case of something unknown. That's important. The Ebola outbreak went on for 4 months. People were seeing cases of hemorrhagic fever, and that it was not reported anywhere. And then the next thing we learned, it became a big problem. 15,000 people died in West Africa because of that. So we need, number one, a continental surveillance system for Africa. And we can do it today because I can send an email, just an email, and everybody will know what's going on in 1 second. All it takes is to have like a platform. So we are in a very good position to have a surveillance, a continental surveillance system where we can share information, because it's all about information. That's number one policy. Number two, like we said earlier, an integrated healthcare system. Okay, I'm seeing a case of a disease that I don't know. I have to be able to ask my colleagues in Cameroon, my colleagues in South Africa, my colleagues in Ethiopia, hey guys, I'm seeing something here that I've not seen before. What do you think that is? An integrated healthcare system. And finally, we have to learn to start producing some kind of basic medical material locally. We do not need, we cannot depend on the West to have a needle, to have even hydroxychloroquine. When I was in med school, we had a pharmaceutical company in Abidjan that was producing hydroxychloroquine. So 30 years later, we have to import hydroxychloroquine from India or from China. So we need to start building a local capacity where we can produce at least basic things that we can use in our healthcare system. So to me, those three things, surveillance, integration, and local production, will be the determinant to kind of build a stronger resilience in the century of the pandemic in which we have entered. Sorry, I was long.
Oh, that is well. No, I think it was well said, and Dr. KADIO, really, I absolutely nothing to add. Very appreciate. That's really well said. I will crave your indulgence if you have 5 more minutes or so. I
Yes.
see there's many questions that have come in. I have a question here from. I'll give a couple, and that way you just pick and choose, and I'm sure you can read it as well. But for the folks on the audience, one is does Africa really need vaccine against COVID-19? Looking at the slow evolution in Africa, the numbers of deaths compared to other parts of the world. That's one. Secondly, in Africa, almost no clinical trials has been done concerning COVID-19 vaccine development. Well, I will clarify that to say some is happening. It may not be as the numbers we want. So there is some clinical trials happening in various African countries. What is Dr. KADIO's perspective for the promotion of vaccination in our region, supply chain, affordability, and things like that, keeping in mind that it helps fight against spreading? Okay. And there is a question from Mr. Francis Tazocha. Um, Many people seem to believe that Africa has been least affected by the COVID-19 because of the diet they eat. Um, that is what they eat. That is what they eat is natural, unlike what is eaten in some parts of the West. What is the truth to this statement? And lastly, I mean, this will be the fourth one. In 1918, the world was hit by the flu pandemic, the great pandemic of 1918. That had almost similar impacts as COVID-19. Uh, what could the world learn from the 1918 pandemic? So I think we'll have that, Dr. Cardio, for you to as you try to wrap up.
Okay. Well, very interesting questions. Uh, does Africa need vaccines? Given the current state of the affair, I would say no, we don't. We don't. However, this is a changing situation. We have to be watchful and not fall in a kind of what we call vaccine hesitancy. What is vaccine hesitancy? There is a growing number of people and concern in the world that is saying that we cannot uh, agree on vaccines. What I'm thinking, I would say here is we have to be careful in our judgment. It's always difficult to make a general statement for everything. This is not the most rational way to go by. We have to be kind of analytical, go almost on a case by case basis. Okay, when we consider vaccines like polio, the polio vaccine, the results are very, 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 very extraordinary. And I think this year, Africa crossed the line about the eradication. We have the certification for polio eradication. And we have to keep it, we have to maintain it. So some vaccines are very good. There are other vaccines that are less useful. And I agree and I understand that. But we have to make a distinction and to be careful enough not to make a generalization on whatever is our thinking. I don't believe in vaccines or I believe in no. It's not all black or all white. We have to be nuanced in our approach. For the coronavirus, if we consider the situation in Africa, it's like we do not need it at this point. However, let's like we said earlier, let's build transparency and see what is it that we have a CDC. We have to trust our CDC. We have government that are making decisions. We have to learn to trust our government. But the government also needs to kind of have an open discussion, a very transparent discussion, and make a decision on whatever it's needed or not. Most importantly, and I'm glad that you mentioned that we have some clinical trials going on in Africa. You don't want a vaccine that has not been tested in Africa to be used in Africa. To me, that will be kind of a red line that we cannot cross. If you did your clinical trials in India, then do your vaccine in India. If you did the clinical trials in Africa, then you have ground to kind of use that vaccine in Africa. But so far, in terms of need, there is an argument if really we need a vaccine for Africa. This being said, I like that question about diet. Well, the reason why the pandemic didn't take the proportions that were projected in Africa, like I said earlier, we have a list of reasons. Diet might be part of it, but to me, one of the key ones will be that ecological factor that I mentioned earlier. Because when you take the countries in the malaria belt, starting from Latin America, Africa, Sub-Saharan Africa, and Southeast Asia, when you take the countries in that malaria belt, those countries actually they reacted very, very well against the coronavirus. So you have some ecological factors. Yes, diet might be part of it, but I mean, it's a complex system. So it's a list of factors. We cannot pinpoint one factor and say it's this one that played out. It will not be accurate to say that. What lesson can we take from the 1918 flu pandemic? The 1918 flu pandemic is what told us and taught us about the face mask. Actually, this is the first pandemic in which face masks were used as a public health response. So PPEs in general, this is a lesson that we can take, but another lesson that we can take from the 1918 flu pandemic, we don't have good numbers, but I think the closest number that I've seen was that Africa was impacted at 2.3% case fatality rate in Africa from the 1918. But I mean, those are numbers from 100 years ago, so we have to be careful. So one lesson is that whenever there is a pulmonary outbreak, probably African people can react, are more prepared to face that outbreak more than any other people on earth.
Well, thank you very much, Dr. KADIO. I have one question, the last one from Dr. Ronald Govina. Excellent recommendations, Doctor. We seem to have a school of African governments and leaders who do not listen. How do we address this? Experts like you are saying the right things. How can we ensure uptake by policymakers? I think that will be our last question, and then we'll close.
Okay. Well, it's always that difficult question. How do we turn recommendations, technical recommendations, into policy making? That's probably we need people like you, Dr. Denis. We need what we call policy brokers that are going to do a kind of a close contact discussion with decision makers in Africa so that we can see some change. But you know what? I'm very, very optimistic for Africa. We will reach a point where our politicians will have no choice but following the wave. There is a wave that is building in Africa. There is a wave that is building. And even I have very good contact with the African American community here. A lot of them are now going back. They call it the year of return. And some are investing in Ghana, in countries like Ghana, in Nigeria. So a wave is building. We have to be optimistic. We will reach a point where our decision makers, our policy makers will have no choice but following the wave. And this is coming, and in not too long of a time. It will come sooner than we think.
Well, Dr. KADIO, this has been great. Now, just to conclude, what are you looking for in the next? I mean, we can't really look far beyond our noses, but in the next 3 months or so, what are you looking forward to?
Well, in the next 3 months, yeah, like you said, it will be very difficult to predict what will go on, but probably I'm thinking 2021 will be kind of a happier year for us.
Yes, no, thank you very much. On behalf of all of us here, Dr. KADIO, I want to really thank you for taking your time, to have this, very riveting conversation with us.
My pleasure.
Looking at the pandemic, its evolution in Africa, the response by our African governments, and some of the recommendations.
Thank you.
Appreciate it. I thank members of our team at the Nkafu Policy Institute that continues to look at these situations and brings experts like yourself to better educate the public and look at all the different ways in which we can help translate recommendations from technical recommendations, as you say, into policy making, and then have those implemented. So thank you very much. And we have this conversations on a regular basis. I thank everybody who was in attendance and asked questions, and we look forward to having this, going forward. Thank you.
Thank you.